Hi there. In this video, I'm going to give you a snapshot, kind of a bird's eye view of how it is that someone develops OP. Now, I'm not going to go into specific detail about systems that break down and specific mechanics that cause OP. Rather, I'm just going to give you an idea of how all of the systems together break down and how they all lead to the mechanics that eventually develop OP. So let's start with this diagram, which I'm going to pop on your screen now. So what you'll see in the diagram is that there are basically three columns, where I start with faulty firing patterns at the very beginning, and that these lead to the development of OP mechanics, and that these OP mechanics eventually lead to the overworking of your adductors, which eventually causes you to develop OP. And so let's go through how this chain of events occur to lead you ending up with OP. So essentially, everyone has these 6 functional systems that more or less take care of the stability, control, and balance of your body. You essentially need these 6 systems to stay upright and move efficiently without hurting yourself and hurting your ligaments and joints. And so essentially these are your arches, your glutes, your core, your sacroiliac joint and pelvic floor, your oblique chains, and your balance system. Now, if you have any weaknesses in any of these systems, you're going to have some structural instability in your body, and you're likely to have some pain, discomfort, or an injury. Now, all OP patients, even before they develop OP, they generally have some sort of weakness or issue in one of their systems. So a lot of OP patients will tell me, oh yeah, I've overpronated my entire life, or I've always had troublesome knees, or I've always had a sore lower back. They've generally already had one of these problems in one of these systems for a long period of time before they actually develop OP. Now, these systems, when they start to fail, they start to result in some very specific mechanical problems or biomechanical faults in the person who has them. So if you have a weak glute system or a dysfunctional glute system, you're likely to see a hip drop. If you have a weak core, we might see an anterior pelvic tilt. So you can see our mechanics in our second column. They're very related and connected to the functional systems in our first column, our faulty firing patterns. Now, where things get interesting is, how do you go from having 1 or 2 dysfunctional systems and a hip drop or sore lower back? How do we go from that to the development of OP? And this is the crux of it here. Essentially, OP patients have weakness and dysfunction in all 6 functional systems. And so what that essentially means is that they are having difficulty stabilizing their entire bodies. And we then see all 5 of those faulty mechanics, those OP mechanics. All OP patients have some degree of all 5 of those. Now, that doesn't mean the degree is the same with every patient. Some people are going to have more problems with their hip drop. Other people are going to have more problems with their pronation. The issue is that OP patients will have some degree of all 5 of those weaknesses. And what that essentially means is that they're having difficulty stabilizing their entire body because every one of those functional systems are compromised. And so therefore, what tends to happen with OP patients, the only thing left stabilizing their body, the only muscle that's still working and protecting their body from injury, is their adductors. And so what you have is the overloading and the overworking of the adductors because of the functional breakdown of the 6 functional systems. So we have 6 functional systems, they stop working. We end up with these 5 really bad mechanics. We end up with a hip drop, bowed knees, overpronation, a locked SIJ, and we end up with a really poor balance system. And essentially what we end up with then is these mechanics, they are negative movement patterns. They provide a lot of force, torsion, and dysfunction and load on your joints. And so you have your adductors really trying to compensate, trying to overwork to try and protect you from the injuries that those mechanics, those OP mechanics cause. They become overworked, they fatigue, they tire, they become extremely tight, they develop trigger points, and eventually they start pulling on the pubic bone and causing osteitis pubis. And so you really see this really simple progression that occurs. Faulty firing patterns, weak functional systems lead to really bad mechanics. These bad mechanics put extra pressure and extra load on your body and threaten injury. Your adductors kick in, really trying to protect you from that injury. They get tired, they get fatigued. OP is the end product of all this overworked and tired adductors. And from this perspective, you can see how fixing OP is really, really simple. We need to bring back online, we need to bring back the function of those 6 functional systems. They need to be working again. They will prevent you from going into those bad OP mechanic patterns. And if you're not in those OP mechanic patterns, you're not overloading your adductors, they get a chance to heal and recover. And that is what the 10-stage protocol is about. It's just about getting those 6 functional systems working and communicating with each other and working effectively so that they can stop poor mechanics and prevent OP from ever coming back.